All right, so let's do a quick question here. Let's go ahead and just do a fundamentals today. See if we can get a question that we can all get here and think through. So we'll go ahead and click start practicing here. And the question is, Mallik, 1997, concludes from her review that the core condition which demands advocacy actions is the vulnerability of the client in two respects. All right, so that's a lot of wording there, but let's look at what we're trying to find out here is patient vulnerability in two respects. So personal vulnerability and also vulnerability to risks inherent in the institutional process to which the client is exposed. Which best describes an example of how a patient would experience personal vulnerability? So this is a good example of sometimes you're going to get questions that are going to have just a ton of words. You can see here, this is a huge question, but all it really wants us to look at, so honestly, we can ignore the entire first 2/3 of the question, because all it really wants us to do is look at which best describes an example of how a patient would experience personal vulnerability. So let's read our options here. The physician orders a new medication for a patient develops a seizure disorder, a patient receives a bill for hospital services, the policy of the hospital require a patient to be discharged to long-term care. So the two types of vulnerability we're talking about here are personal vulnerability and vulnerability due to institutional processes. So if we look at here, so the physician ordered something, the patient got a bill, and the patient's being discharged to long-term care. So let's click here, patient develops a seizure disorder. That's the only one that's really not something to do with them being in the hospital. This is something that they develop that's due to a condition that they develop. So let's see what that, and we're correct, okay, so that's good. So with those, you know, a lot of the options were like the physician did something to the patient, the hospital did something to the patient, or I don't remember the other one, but that something happened to the patient around their care, where this was the only option that was really something personal. So it's really personal vulnerability versus like institutional vulnerability. So let's read the answer here. Nurses have an ethical obligation to advocate for their patients. A patient who receives care is vulnerable in terms of his illness and his experiences with a healthcare institution. The nurse must act as an advocate for the patient in both situations. So let's see here. Personal vulnerability refers to the illness that the patient is experiencing. A patient who develops a seizure disorder must learn to manage his illness and therefore has developed personal vulnerability. So while it's been, you know, quite a while since I've taken nursing fundamentals, what you can do here is you can really look at, okay, we're talking about two types of vulnerability, personal and institutional processes. And what we're able to do is, first of all, we ignore this whole first half of the question here, and we focus on what is an example of personal vulnerability. So we can kind of ignore everything else. We don't need to know who Mallik is, and we don't need to know about everything, all their research study. We just need to know what is an example of personal vulnerability. And even though I don't really remember what that is, what I can do is I can look at what's the one that's different, kind of. And it's very easy to quickly see that institutional processes, getting prescribed something, a bill, those are all things that are institutional, that the hospital is doing, you know, to the patient, or the type of care the patient's getting is doing something to them. The personal vulnerability is this disease that they're experiencing. It's the different one. So that's a good example of how you can kind of work through the question, ignore what you don't need to know. If you spend all your time worrying about who Mallik is, be like, oh, free, I don't even know who that is, then you could really get yourself in trouble. So don't worry about all those things that don't matter. Really identify what the question wants you to know, all right? And then go from there.